We're going to be talking about, does Medicare cover you when you travel? Let's get into it. So, this is a big thing, obviously, because a lot of you are approaching retirement and you are wanting to do what retired people do is go travel. So let's find out what the Medicare, this is straight from the Medicare and You handbook. Okay. The source for the rest of this video is going to be from the Medicare and You handbook. I'm going to break it down into specifically Medicare supplements versus Medicare Advantage coverage, and we will see the actual fine print on what it says for both of them. So the general rule here is Medicare doesn't cover healthcare outside of the United States. If you go with this general rule, then you won't be upset if it is otherwise. In other words, if you expect full coverage outside of the United States because you were to assume that Medicare covers travel, then you'll be let down. Okay. If you go with, hey, I don't have coverage outside of the United States, therefore I should get travel insurance, you won't get let down. There won't be any surprises. So, what is defined by the United States? It's going to be the 50 states plus our territories. All right. So, this is from the Medicare and You handbook, and we're talking about specifically original Medicare. Now, Medicare may pay for inpatient, hospital, doctor, ambulance, in very limited situations. Emergencies, and you should define an emergency as a life-threatening issue. Okay. Um, Traveling directly between Alaska and another state. So there's got to be no unreasonable delay. And yes, there's Canadian hospitals closer to the US borders that may understand how to bill Medicare, but maybe not. Lives in the US, but foreign hospitals are closer to home. Example, some residents near the Canadian border. Doesn't this slide see, if you are like, well, that doesn't answer my question, it doesn't answer my question either. Okay, which is why, and obviously you wouldn't be walking in anywhere really with just the A and B card. You're going to have A, B plus a Medicare supplement, or you'll have a Part C plan. So this slide I put in here to intentionally create this gray area, because we're going to move on to what either your Medicare Advantage plan covers or your Medicare supplement. So, with that being said, obviously, routine care is not covered abroad. So please don't feel like, hey, it's time to get my annual mammogram done, and I'm in Cabo San Lucas. I better go ahead and just do it. Please don't do that. Okay, so we're getting into Medigap coverage. So you've got original Medicare as your primary. You've got a Medigap supplement as your secondary. So here's what the handbook notes, and we're going from the handbook because remember, Medigap plans, they're standardized. Like that's the federal rule. A Plan G with United Healthcare versus a Plan G with Humana versus a Plan G with Cigna, they all have to cover the same thing. And here are those bulleted coverage. So in an emergency care, the first 60 days of travel. So if y'all are doing these longer stints of a holiday or vacation, just note that it is 60 days. Okay. It will pay that 80% after the 250 deductible. That's that Part B. That's how you know it's Part B. It's 80% after the deductible. And actually, y'all, I'm sorry. That deductible should be 283. So mark that out, put 283. I'm still stuck in previous years because that deductible changes all the time. This hasn't changed though. It's got a $50,000 lifetime limit on these particular letters of a Medicare supplement here. So, what does that mean? It means go abroad. You've got some coverage with your Medicare supplement, but you should get travel insurance, right? to cover those unforeseen, non-life threatening issues. In anything, and this is in anything that you do, right? I mean, you get, maybe some people get phone insurance. So, we all have house insurance, auto insurance. Insurance is obtained for the situations that you could be in the future, and that's why one gets insurance. So if you are traveling, you should therefore get travel insurance. Hopefully that makes sense. So in the Medicare Advantage realm of things, um, plans must cover emergencies, uh, that are needed. Many MA plans, Medicare Advantage plans, cover emergency care worldwide. I should have made this bullet one, size 50. Check the plan's evidence of coverage for specifics, because unlike Medigap plans, these are not all the same. Okay, these no, what is it? Not all plans are created equal. Okay, so I snapped a actual from a summary of benefits of a very well known company on a very well known plan. And this is what it says: emergency services at an emergency room. If you are admitted to the same hospital within 24 hours, okay, sorry, go to that bullet, the bold. We cover emergency services worldwide. If you have an emergency outside the US and its territories, you will be responsible to pay for the rendered services up front and can request reimbursement. If that sounds really vague to you, it also sounds really vague to me. I'm just bringing this to your attention. Ergo, and I don't even sell travel insurance. That's the funny thing. So this is not a travel insurance video, but obviously we should be looking at travel insurance, because what does that look like? It is not clearly defined. It is not, a specific copay like most of the services rendered on a Medicare Advantage plan. You will see specific copays, and you know that there is no surprise over that copay. So number one, you've got to have, the ability to swipe a card or to pay that cash, responsible to pay for the rendered services upfront, and then you request it later. What the insurance company actually pays for upon that request, I wouldn't count on it being 100% of the services rendered or the payment that you handed over to that emergency room. Okay. So, all in all, Medicare doesn't cover care outside the United States except in rare border situations. My formal recommendation is, if you are traveling internationally, you'll usually need travel insurance or a Medigap plan that has that, more of that $50,000 lifetime limit, for foreign travel emergencies. So that's my recommendation.